Good afternoon. Welcome to those who are just joining us for this session, and thank you to those who are joining us again at this career session at the TIDES Converging Approaches to Sustainable Resilience Capabilities demo, hosted by Mason's Center for Resilient and Sustainable Communities. Our second speaker today is Stacy Terrell, the Diversity and Inclusion Manager for USAID's Global Health Technical Professionals Program. And in this role, she works to increase outreach and ultimately hiring of populations underrepresented in the fields of global health. She received her MA in International Affairs from American University and her BA in International Development from the George Washington University, where her research focused on inclusion of Afro-Latino populations in political spaces. And today, Ms. Terrell will talk with us about global health career opportunities with USAID. There will be some time for questions following the presentation, but do feel free to post questions in the chat throughout the presentation. And I will also be posting links to an attendance sheet throughout. So please do complete that when you can. So with that, I introduce Stacy Terrell.
Thank you, Hannah. I'm excited to be here today. I'm excited to be part of this career series during your conference, so thank you. Just want to start off with just a bit of a disclaimer that, as she stated, I am representing the Global Health Technical Professionals Program. We are supported by USAID, but I'm not intending to speak on behalf of the US government or USAID more specifically. So what we generally do is just a brief introduction, and then we'll go into specifics of work at USAID, and then talk about 3 specific programs that may be of interest to current students, recent graduates. You can feel free to ask questions in the chat throughout. I'm happy to pause and answer them as we go, and I will make sure we save time at the end for more in-depth questions. So one thing that might be helpful for me is just to see if anyone wanted to share what are some areas of global health that they're most interested in, or if it's beyond global health. We do work with the Office of Foreign Disaster Assistance, the Office of Food for Peace. If there are any technical areas that you're most interested in, feel free to just chat those below so I kind of know how to gear my talk today. And it could be anything from health as it relates to disaster response, maternal and child health, could be interest in supply chain, any sort of area of interest that you have. Or you can unmute as well, either one.
What about, I'm just looking at the attendees and making some suggestions. Would you be able to cover things like governance of these types of issues, or how maybe communities can be more engaged in their own becoming more resilient in terms of health?
Sure. Yeah, that's definitely an area. And we say health broadly, but obviously even within the Global Health Bureau, the work that they're doing encompasses a lot of different things. So it encompasses, how we're creating stronger programs. It encompasses economics. It encompasses a lot more of the SDGs that you have behind you, other than just straight up provision of services. So yeah, that's definitely, we'll talk more broadly about that work. So one of the things that is important, I guess, especially for this audience, if we think about career opportunities more broadly within the agency, and if this kind of speaks to global health, but these are applicable throughout the agency's work. In terms of the career possibilities, for us, we see that every role will involve the skills below. And I think this definitely goes beyond health. So looking at things like your data evaluation skills, research skills, experience that you have working across diverse cultures, communication and management skills, and then really across the board for the agency, a passion for solving complex challenges in a global context. So that definitely goes beyond the health work that we do. And then in terms of the categories of this work, so people hear global health and they immediately think of healthcare provision, and that is one aspect of this broader field of global health work, but that's not normally the work that the Global Health Bureau or USAID at large does. The other three areas, program management and advising, program development, and then research and policy, are more of what the agency as a whole does. And I would say that program management and advising and program development are really the bulk of what a career at the agency looks like anyways. Obviously, it's a donor organization. So the work that anyone is doing is either, creating programs, projects, designing those, evaluating those. So you're either in some process within the creation, the evaluation, the current monitoring while the program is happening. So that's really more of what the agency is doing. And that really does span across different technical areas besides health. And just to put in here, I'm sure that you guys are more than familiar, but just in case, USAID is the US government's arm for doing international development and humanitarian assistance work. It operates in over 100 countries around the world. The bulk of our positions are based in Washington, D.C., where USAID is headquartered, but all the programs that we'll be talking about today do have opportunities that are based overseas at USAID missions. So just in terms of spending within the agency, and obviously this includes spending beyond just health, then number one, the highest amount of spending that we see on this brief graph is around emergency response. So that is a big chunk of the money that is spent at the agency. Then after that, we have HIV/AIDS, then government and civil society, obviously operating expenses a little bit further down there, and then you have other areas of interest, development and food aid. So that's, again, working with the Office of Food for Peace and Bureau for Food Resilience. And then conflict and peace and security are below there. If we think about geographically where the spending is taking place, this is a map. The darker areas show where the heaviest spending is happening. So you can see there's a lot of investments in Sub-Saharan Africa, Central Asia, a little bit in Eastern Europe. The one kind of brighter blue spot in Latin America, I believe, is Venezuela, which is focused on humanitarian response there. So when you think about, I guess, your career goals and maybe language skills that you have at the moment, really take a look at where the agency is investing a lot of its money, and that will show you kind of what language skills or what geographic expertise you may have, that there may be more positions available that focus on that. So for us, we see that having proficiency in French is a really great asset because of so much of the work that we're doing in Francophone Africa. To a lesser extent, Portuguese is also an asset, but just to single those two languages out, we do believe that fluency in any language is going to be an asset to you in your career. And then just, from a Global Health Bureau perspective, this really does reflect the agency or the office's three strategic priorities, which are preventing child and maternal deaths, controlling the HIV/AIDS epidemic, and then combating infectious diseases. So in terms of the career options that are out there for you to be able to support USAID's work, no matter what bureau or what office you're interested in pursuing, they will fall generally into one of these four categories. And some of these categories kind of overlap. So you have your direct hire government employees, which many of you all, especially those in the DC area, are likely familiar with. People who are civil servants or foreign service officers, those would all fall into the category of direct hire government employees. There's a lot of different types underneath there, but the important part is they're in one of those two categories. And then we have fellowship opportunities. So that can be things like the AAAS fellowship or the Presidential Management Fellowship. So there's so many different opportunities for students in particular to kind of break into this work through paid fellowship opportunities. So that's another category in terms of supporting the agency's work. Then we have internships. So for us, we'll talk about one prime program that provides internships that are paid related to global health as we go forth in the presentation, but there are also other internship opportunities throughout the agency, some of them paid, most of them, I would say, probably are in that unpaid category with a couple of exceptions. And then we have contractor employees. So contractor employees, particularly for the Global Health Bureau, are about 2/3 of what the workforce within the Bureau is. So there's a very tiny percentage of people who are direct hire employees, whether they be civil servants or foreign service officers. So when you're thinking about, you might see somebody who's working within the Bureau or other bureaus and you think, I really want to do that work. I need to go on USA Jobs and fill out a lengthy application. It's really important to think about the fact that the bulk of those people that are doing the work that you maybe are really interested in are likely contractor employees. So it's important when you're looking at your job search options to think about who are the companies, not-profit organizations, or other entities that are implementing these large hiring contracts for the agency, so that you can submit applications through those contractor organizations as well. And USAID on their careers website does a really great job of kind of breaking down a lot of different hiring types that are available and places to go seek out those opportunities. For USAID specifically, and I would say even more specifically, if you have a strong interest in disaster response work, personal services contractors are another key hiring type that kind of fall in the in-between between contractors and direct hires. And so that's another hiring mechanism that makes up a good chunk of many of the offices that are doing disaster response work. And so again, when we think about USAID as a donor organization, it really is conducting programs primarily through contracts, through grants, through cooperative agreements to implementing partners. So those implementing partners can be businesses, they can be ministries of health, they can be host country governments, or they can be nonprofit organizations. So if you are interested in, at least for the Global Health Bureau, they do have a really thorough Global Health Users Guide that they've updated and made available on the web, so that if you are interested in a particular country or a particular type of project, type of work, maybe you want to look into WASH support and you want to see all of the contracts or grants or cooperative agreements related to that, you can take a look at this guide. It will tell you then what company or nonprofit or Ministry of Health is implementing that program. And that's a great way to see what opportunities are going to be available through that implementing partner. So today we're just going to talk briefly about 3 programs out of the Global Health Bureau. That is the program I work for, Global Health Technical Professionals. And the other one is Global Health Support Initiative 3. And lastly, Sustaining Technical and Analytic Resources. So GHTP is a USAID funded program that's really designed to connect diverse talent with career opportunities at the agency. So we recruit and support early to mid-career global health professionals across a wide variety of technical areas. Each of our technical professionals are paired up with a professional development coordinator. We know, especially if you're coming into this role and you're in that early to mid-career phase, it's important for you to still continue to pursue new training opportunities, attend conferences to continue to grow professionally. So we provide each of our technical professionals with $3,000 in funds every year, and they can use those for conferences, for training opportunities, language acquisition, really anything that relates back to their career goals that they've set out for that particular year. We also have a mentorship program where we match up our staff with folks either within the agency or outside of the agency that are going to help them with the established career goals that they have. And we also have a Future Global Health Leaders program that we have created as a way to make sure that we are tapping into younger audiences. So this might not be relevant to everyone here, but it's really important for us to be providing global health career resources, webinars and discussions to undergraduate students, particularly those that may not have global health or public health as a major at their school. And so this program is our way of being able to share that information, share a toolkit, and kind of build a network. So we are actually having a webinar through this Future Global Health Leaders program in 2 days. So if you're interested in a webinar where we will be featuring people across different hiring types. So we'll have foreign service, contractor, personal services contractors talking about their own global health career journey as a way to kind of help people in the early career phases really understand how these mechanisms work and function and best ways to get into them. We just highlight a few technical areas here. Obviously, this list is not exhaustive. We have folks who are based not just within the Global Health Bureau, but also we have folks in regional bureaus. We have folks who definitely are engaged in humanitarian and disaster response work. But again, all of our folks pretty much are touching in some way, shape, or form the program design, project design, evaluation space. So for our opportunities, it is open to either US citizens or permanent residents. And that is simply because of the security clearance requirement. So our folks who are based in DC have to sit in USAID space. And depending on what space they're sitting in, it requires either a secret level security clearance or just a facility access clearance. So that is the only reason that we have restrictions around the citizenship or permanent resident requirement. In terms of education, we at a minimum have as a requirement either a bachelor's degree in 5 years of professional experience or a master's degree in 3 years of professional experience as it relates to whatever that job description is. This doesn't have to be in succession. So if you have done internships or you have any sort of work experience that you've gained throughout the time that you've been an undergraduate or graduate student, all of those years of experience count towards that job description. So it's important to really think about, any professional opportunity that you have, whether paid or unpaid, if it relates to that scope of work that you're applying to, make sure to include that in your resume so that we can count that in with all of your years of experience. And this is just a brief glimpse at what a potential job description might look like. So we know technical professional is very vague. That can mean a lot of things. But again, we try to make sure that our job descriptions are going to be pretty specific, even down to the percentage of travel that you might expect in that particular role, whenever it is that we are traveling again. So this is job description. These are just some brief bullets that really spell out what that work might look like. And again, a lot of it is, reviewing technical aspects around proposals or project design. It's providing guidance on developing country strategies. It's, conducting critical country level sector analyses. So if you're focused on nutrition, it might mean that you have, a particular area that they want you to focus on. And you provide guidance just on that particular region or sub-region. And then it's, things like supporting knowledge management, monitoring, evaluation, and learning efforts. So overall, if you're based in Washington, D.C., the agency's goal is that Washington supports the mission. So if you were in D.C., that means the work that you were doing is going to be in support of something that is happening overseas at a mission. So a lot of your work may be just being on the phone with folks in the mission. It may be providing any sort of technical guidance that you can. But generally, whatever's happening in DC is not for it just to be happening in DC. It is in support of the implementation of activities that are happening on the ground. So we did actually ask, we've asked a lot, what is the day-to-day work like in whatever their role is. So we asked one of our nutrition associate advisors, this is Quamel Hanks. She serves in what was formerly the Bureau for Food Security, now the Bureau for Food Resilience, to my knowledge. And she shared that, in addition to the logistical and administrative support that she provides to her team, she also provides technical nutrition support to the field. So she supports about 5 countries in West Africa and Central Africa. And that support can look like reviewing strategies that they're developing or activities that they're designing. And one thing that we know for sure is that no 2 days are the same for pretty much all of our technical professionals. So I think that's something to keep in mind too, that the scope of work is there. It provides, an overall framework for what that work may be. But as the needs change, the work may change slightly as well. We do want to share just some skills and experiences that we think will help you stand out, no matter what positions you're applying to. And I think these are really things that are not limited to just the field of global health. So as I mentioned before, fluency in another language is really a great asset. I think with that, strong cross-cultural communication skills. So thinking about maybe not just your work that you may have done overseas, but also work that you've done domestically, working with folks who were different than you, and then having an understanding of key health issues or key issues in your particular technical area, especially as it relates to displaced populations, refugees, or other vulnerable populations. And again, thinking about how you may be able to do that work domestically, especially as we are obviously in this current moment not able to travel right now, thinking about ways that you can bolster your resume with work supporting displaced populations, refugees, and other vulnerable populations here in the US if you're based here. We also say that being flexible, having openness is definitely an asset. Obviously, if you're working in disaster response, needs change quite fast. So it's important to remain flexible. And then I would say teamwork and having strong interpersonal skills will take you a long way. So one of the things that we hear a lot, and I experience it through my own grad school experience, group projects just can either, really make or break you. And a lot of people finish grad school and they say, oh, I never want to do a group project again. But it's really important to think about the way that the agency works. The decisions that are made are very collaborative. And when you're dealing with a lot of complex subsets of data and complex situations, you're bringing a lot of different stakeholders, even within your office, within your team, to the table. So you're pretty much kind of forever doing group work as you work for the agency. So it's really important to keep that in mind as you're going through maybe team experiences as a current student, a recent graduate, or in your role right now. So think about how you're participating in some of those activities and think about how you might be able to talk about how you succeeded working in a team if that were to come up within an interview question, because it's a reality of what your work would be like supporting the agency. And so we list here too, any experience that you have living or working abroad. It could be through experiences like Peace Corps, Atlas Fellowship, or Atlas Corps, Global Health Corps, other like-minded programs, but also thinking too about your lived experience. So if it wasn't studying, but you have experience living abroad because that was your home, thinking about how you really spell out your experience and a lot of these key interpersonal skills within your resume. Don't let those sort of key assets that you have slip through the cracks when you're putting your resume together. We just wanted to list out some of our current opportunities. Obviously, there are a lot of different technical areas that you can see here, a lot of different types of roles. This may not be for you at the moment, but definitely want you to take a look, when you have time, take a look at the job descriptions and see, is this work I enjoy doing or would enjoy doing? Are there things that I need to, are there skills that I need to build in order to apply for this position? I think that's always just a good exercise to be able to do. I think we definitely want to highlight Global Health Support Initiative 3 or GHSI 3, particularly for those that maybe you don't have 3 years of professional experience under your belt, but you want to be able to break into this work and work at USAID. So GHSI 3, in addition to offering mid-level global health opportunities, they also hire a lot of entry-level program assistant and program analyst positions. A lot of that work can be administrative in nature, but I would argue that most of the work at the agency, because it's a donor organization, has an administrative component and a program management component. But it's a great, really entry point. They're usually only asking for like a year of professional experience, paid or unpaid. So it could be a really good foot in the door. And a lot of our staff that we have now previously served as program assistants or program analysts. These positions, if they're going to be based in DC, do still require the US citizenship or permanent resident status because they do still require the security clearance. The Sustaining Technical and Analytic Resources Program, or STAR, that one offers a lot of different types of eligibility. So if you are not a US citizen or permanent resident, this could be a great opportunity for you to take a look at. They offer positions for folks who are nationals of the country that the work might be taking place in, or citizens of a third country. So this is definitely a great entry point within the agency, especially for those who are not US citizens or permanent residents. They offer paid internship opportunities. I think that's what's most applicable to this group today. So if you were interested in any of these internship positions that are listed here, definitely take a look at their website. Again, it's an internship experience. They're really only asking that you be either a current student or a recent graduate. That's the minimum qualification there for those. So it's another really great entry point into the agency, especially if you don't have a ton of experience and you're really looking for a substantive opportunity to learn more about the work of USAID and be embedded in it. So I'll skip there to make sure that we have time for questions, but wanted to list the websites for you to be able to find these career opportunities. If all else fails, you can go onto our website, which is globalhealthtp.org, and we have a global health hiring mechanisms page that'll take you to GHSI's opportunities, STAR's opportunities, and USAID's career site as well. So happy to answer any questions you may have. I know our work in this program is focused on global health. As she read in my bio, I actually did work for USAID as a personal services contractor for 3 years. in the Office of Transition Initiatives. So I do have experience in that realm of humanitarian assistance and especially swift response. So happy to answer any questions in either of those areas.
Thank you so much, Stacy. A lot of really good information, and I'll also post some of these links for social media so that people can access them after the presentation. Does anybody have any questions that they would like to ask? You can feel free to unmute yourself, or you can also type into the chat box. I would really encourage you to go ahead and unmute yourself, but if you're shy, that's fine. Well, I can get us started. Oh, I've been told not everyone might be able to unmute. I just clicked a button that said allow participants to unmute. So if you cannot unmute, then send a message in the chat and I'll unmute you personally. But one of the questions that I was thinking of asking is I saw, if you don't mind, it's kind of about your background.
Oh, sure.
I noticed that your background is in international affairs and international development. And I was wondering kind of how much you were involved in global health before starting to work with the Global Health Technical Professionals Program.
Sure. So global health specifically was not that involved. I think basically my work in the Office of Transition Initiatives at USAID, they're more focused on political transitions than anything else. But I was working in the operations division. And then I started to get more involved in hiring and doing technical evaluation committees. And I started to really bolster our work around how we hire and who we're hiring and who's left out. And so that work led me to shifting my focus around diversity and inclusion. And that was more the focus of why I shifted to supporting global health. So I was previously working for the Global Health Fellows Program too, right after I left the Office of Transition Initiatives. And so my work was more about supporting the recruitment and kind of reducing barriers to entry for people interested in work overall at USAID. So my specific background, I think in undergrad, I did take like Intro to Global Health, but I don't have an MPH. My background is definitely more on the just straight up international development side.
Thank you so much. Are there other questions for Stacy? All right. Well, if there are no other questions, then I will say I'll blabber for a little bit just in case.
I have one chatted question.
So the question is, are there any surprising or specific skills that you think will become more in demand for USAID in the future? For instance, when you have as many great applicants as USAID probably does, what are some of those specific skills that can help boost some people over others?
I think we're seeing a lot of attention around data visualization. And I think part of that is because any area of the agency that you will work in, you're dealing with extremely large data sets, and then you're dealing with the fact that you have to report to Congress on how you've spent this money. And so you can't, you have to create easy ways to explain the work that you've done to a lay person. And data visualization has become a really great tool in addition to just like GIS work. And so kind of those two together, I think is a really key skill set. And I see people who've been, 20-year veterans really being supported and coached by interns who have a strong, they can use Tableau really well. So that's something that I think is not going to cease in terms of importance. And then I would say a focus on unique partnerships. So one of the latest things that's come out of the agency is the New Partnerships Initiative. So interested in how we can get resources from new entities to be able to fund development work. A lot of focus on private sector. So if you have interest in those particular areas, I think that's definitely something that you want to continue to bolster your skill set is. The reality is that, we've been not going anywhere for 7 months. The work has needed to continue. And so the importance of us, my American self physically being in another country to do this work, we've kind of seen that it's not necessarily, it's not a must. And so what does that mean for how we give ownership, both, literally and figuratively back to the countries that these activities are taking place in. So if that's an area of research and interest for you, I would definitely encourage you to pursue that as well, because that is the direction that the agency is moving in, giving the ownership back to activities in terms of design and funding. So yeah, those are two very different buckets.
That's really useful. Thank you. And to kind of add on to that, these aren't necessarily skill sets or areas where people would need to have a major in this or be able to have a certificate if they can demonstrate the skill set, right?
Yeah, I think there's never been a requirement that folks have to have an MPH to do this work, particularly when you think about something like data visualization or data analysis. A lot of graduate programs across the board are going to have you complete some project where you might need to exercise those skills. So it's really about how you spell out how you've done that within your resume, highlighting that you know how to use these types of programs, and then I think especially around private sector work, you definitely do not need to have an MPH. Most of that work really requires you to just have experience within like private sector engagement. So if you're working at a nonprofit and you were getting, private sector donors, that's a skill set that you're exercising that would not require, and really, I don't know what kind of degree program would necessarily prepare you to do that work itself. So yeah, I don't think it's a degree requirement.
Great, thank you so much. And also, I just want to point out that we're having another career session tomorrow, starting at 2:45, and we'll have a panel followed by Ask Me Anything. And one of our panelists is Joseph Esri, who is the education manager. Did I call him Joseph Esri? Joseph Kursky, who's the education manager at Esri. So he might also have some good tips about how to get some inroads into GIS and data visualization in that way.
Definitely.
Well, with that, I just want to thank you again so much for sharing all of this knowledge and information with us. I really appreciate it. There is some contact information up on the screen for those who are interested in following up. And also, if you are interested in learning more about CRASC or joining our email list, we have a website, c-rasc.gmu.edu, that I will throw in the chat right now. And you can join our listserv right there to keep in touch with events and announcements that we have. But hopefully you'll be stopping into some of the other sessions in this event, and I appreciate everyone who made it to this session today. And thank you very much, Stacy, for the presentation.
Have a good day.
Have a great